Is your weight increasing, but you don't understand why it is happening? Do you often think, I don't even eat that much, then why is my weight increasing? Many people keep trying to lose weight, but without understanding the real reason, it often becomes difficult to succeed. So today, we are going to do something very important. We will begin the weight loss journey by asking the right questions to ourselves. And at the end of this video, I will also give you a small task, which will help you understand the real reason behind your weight gain. Now let's come straight to the main point. This is day 3 of our 35 days weight loss challenge series. And today we will understand if your weight is increasing, what questions you should ask yourself. I am Dr. Shreyashi Chatterjee, medicine, diabetes and hormone specialist. In this entire series, I am explaining the journey of weight loss in a simple, practical and medically correct way. In the previous part, that is part 2, we discussed what should be the correct and realistic goal for weight loss. Today, keep a pen and paper ready and write down your answers to the questions that I will ask in this video. First of all, you need to honestly think about your weight. The first question is, how much has my weight increased? Have you checked your weight in the last 6 months? Has your weight increased by just 2-3 kilograms? Or has it increased by 10-15 kilograms? And the most important thing, over what period of time has the weight increased? If the weight has increased suddenly over a few days, it is often due to water retention in the body. But if the weight has increased slowly over months or years, then the reason is usually fat accumulation in the body. Another question you should ask yourself, have you recently started exercising or going to the gym? Because sometimes weight increases, but that may not be fat, it may be muscle gain. Now the second question, where in the body has the weight increased? Is fat increasing mainly around the abdomen? Do you notice puffiness around the eyes or face when you wake up in the morning? Or is the weight increasing all over the body? Do your clothes feel tighter than before? Another important question, how much salt are you eating in your diet? If you consume too much salt, the body can hold on to water. Because of this, your weight on the weighing machine may suddenly appear slightly higher. Now let us talk about your eating habits. Ask yourself, what do you usually eat for breakfast? How many times do you eat during the day? Do you keep eating snacks in between meals? And at what time do you eat dinner? Many people feel that they don't eat much, but if you keep eating small amounts throughout the day, the total calories can become quite high. Another important question, how much do you eat? Has your portion size increased? Do you take a second serving after finishing your meal? How often do you eat fast food, outside food, sweets, chocolates or chips? These small things can slowly lead to weight gain over time. Now let's talk about what you drink. How much water do you drink in a day? But also think about this. How often do you consume cold drinks, packaged juices, sweet tea or coffee? Sometimes people consume more calories from sweet beverages than from food. Now let's come to your daily routine. Ask yourself, do you exercise regularly? How much do you walk during the day? Or do you spend most of your time sitting on a chair, at work, at home, or using your phone? Do you use the stairs, or do you always take the lift? Today's sedentary lifestyle, meaning very little physical activity, is a major reason for weight gain. Now, another very important factor, sleep. Do you get 7-8 hours of sleep every night, or do you stay awake late at night using your phone or working? Lack of sleep can change the body's hormones, which can increase appetite and lead to weight gain. Now let us talk about stress. Are you experiencing a lot of stress in your life right now? Worries at home, pressure at work. Do you sometimes notice that when you are sad or stressed, you start eating more? This is called emotional eating, and it is a very common reason for weight gain. If you want to watch the complete weight loss series, you can click on the card above and watch the full playlist. Now let us look at some medical questions. Have you ever had your thyroid tested? Do you have diabetes? Are you taking any medications that may increase weight? For example, steroids, certain medications for depression, or insulin. Now, a few important questions for women. Are your periods irregular? Do you have PCOS? Another common reason is water retention before menstruation. In many women, a few days before the menstrual cycle begins, the body holds on to water. Because of this, the weight may appear to increase by 1-2 kilograms temporarily, but it usually comes down again after the periods. Another important question: is there any chance that you might be pregnant? Because in early pregnancy, weight gain may start gradually. Another factor is family history. If your parents or siblings have obesity, diabetes, or thyroid problems, then the risk of weight gain may be slightly higher. And finally, ask yourself, has there been any major change in your life recently? A new job, marriage, working from home, or quitting smoking? These life changes can also affect body weight. Sometimes, sudden weight gain may also be due to water retention in the body. If the kidneys are not functioning properly, the body may not be able to remove excess water. In such cases, puffiness around the eyes and face may be noticed. And if there is heart weakness, known as heart failure, water may accumulate in the lower part of the body. This can lead to swelling in the legs and ankles. If your shoes suddenly feel tight, or if you notice swelling in your legs, this should not be ignored. Now let's remember the key points. If your weight is increasing, the first step is honest self-assessment. Understand how quickly the weight has increased over a few days or over many months. Also try to understand whether the weight gain is due to fat, muscle, or water retention. Eating habits, daily activity, sleep, and stress all play a role in weight gain. Medical causes such as thyroid problems, diabetes, medications, hormones, pregnancy, and family history should also not be ignored. Asking the right questions is the first step in your weight loss journey. Now let's come to today's Day 3 task. Take a diary or a piece of paper and think about all the points discussed in this video. Then write down which of these factors are present in your life that may be contributing to your weight gain. For example, eating habits, low physical activity, sleep, stress, or any medical condition. Write these points honestly and slowly start working on correcting them. That is your Day 3 task. In Day 4 of this series, we will understand how to set realistic goals for weight loss. Because without setting the right goals, the weight loss journey often stops midway. If you found this video helpful, please subscribe to the Medical Diary of Dr. Chatterjee. The information shared here is collected from trusted sources such as NHS UK, Mayo Clinic, Cleveland Clinic, and Patient UK. With that, today's part comes to an end. Take care of yourself. This is Dr. Shreyashi Chatterjee signing off. Goodbye.